Hello, I'm Dr. Len Saputo. I'm the founder and director of the Health Medicine Forum. I've been in practice in Contra Costa County for more than 35 years, and I'm the host of our show, Pioneers in Healthcare. Today we have with us a very special guest. We call him the Uncommon Doctor, Dr. Joe Prendergast. Dr. Joe is boarded in both internal medicine and endocrinology. He taught at the University of California in San Francisco as an associate professor for more than 30 years. He's on the staff at Stanford. He's published many research articles in the Journal of the American Medical Association, the New England Journal, and others. He's written a book, and he does his own research in Palo Alto, where he runs a practice very effectively. Dr. Joe, it's great to have you on our show today. Thanks for joining us.
Thank you for having me. This is fun.
Well, you're one of the special pioneers in healthcare, in my view, and we've had some experience before on KEST Radio, where you've been a guest there many times. And what I found is that we're soulmates in a lot of ways. Right. You bring the academics, okay, the qualifications into medicine, but you've gone beyond that, and you're bringing in the common sense. That's why I guess they call you the Uncommon Doctor. And today we're going to focus a bit on the miracles of vitamin D. You know, we call it a vitamin, but actually, as an endocrinologist, you're calling it a hormone.
That's correct.
Why is that?
Well, it is a hormone. A hormone is defined by something that is made somewhere and then goes somewhere else to act, basic terms. And what we see is the action is very different. It's different because it goes in lots of other places. And that's what D does. It goes to the liver, it goes to the kidney, it goes to the nerves, it goes to a lot of places. And it doesn't stay suck into the fat that we used to think of for years and years. And it's really not what I learned in the 8th grade, which was really, really different.
Probably not what you learned in medical school either.
That's correct, too.
Because there's been a big shift in how we look at vitamin D.
Absolutely.
And I know you've been interested in it since the 1960s. So you must have quite a repertoire of information about vitamin D. How did your learning experience start, and where's it taken you?
Well, one of the funny things about it is I was finishing up my training, finishing internship, and going into some other specialty, like yourself and all. We had a situation where a lot of us interns were in the room, and one of the gentlemen turned to me, said, "What are you going to do when you grow up?" And I said, "Well, I'm going to be an endocrinologist."
All right.
He said, "I am too." And what are your interests? Well, he said, "You know, I'm going to Creighton University, and I'm going to study vitamin D for the rest of my life."
My goodness.
Yeah, that's what I said.
Why do you say something like that?
Well, and I said, "You must be an idiot." I mean, everybody knows all about vitamin D. And he is today the foremost leader in D research in the world.
My goodness.
I haven't seen him since then.
Oh, you guys must have collaborated some.
No, not really. We just sort of went our own way, and I kept remembering his name, and I just kept watching all his papers, which are excellent, excellent.
You know, most of the talk about vitamin D now, at least we've gotten somewhere, is an osteoporosis, the treatment of that. Yeah. And we're into using all these drugs, the bisphosphonates and a wide range of other drugs that are used to try and solve that problem. But aren't we really looking at a vitamin D deficiency there most of the time?
You're absolutely right. And it is responsible because of two basic things. First of all, we have D levels in our society, which are all low.
Yeah.
We didn't know they were low. They used to figure out what the mean level was on the hospital, 100 admissions, you know, 2 standard deviations, and that's normal. It's not. Everybody going in the hospital sick.
More like average.
Yeah,
but
not real.
But not good.
That's exactly right.
And so in people who have osteoporosis, then, instead of using the drugs, maybe you should be measuring vitamin D first and thinking about some other things?
That is what we do now, right.
So what kinds of things are you doing in terms of doses of vitamin D for people who have osteoporosis?
Well, we no longer worry about toxicity. I have used in many situations, many of it cancer, maybe not, 50,000 to 300,000 units, depending on the situation. Never seen anybody get toxic.
You know, if you took your boards in endocrinology and you answered it that way, they'd flunk you.
I'd still be back there.
So you have something to add to this.
Well, it's not me. The second thing about this is, you know, I just like you were saying, we try to do whatever we see in science is what to do. The difficulty is many physicians say, well, it's not enough data. Well, you can look at it if you know the situation, know the field, understand, well, there's enough to very gently go forward, and that's sort of where I was. It began with a fight. I was in a little discussion with Eli Lilly. They came out with a wonderful drug for osteoporosis. It's called Forteo. We've used it a lot and all, but a lot of times we found people were having terrible shock reactions. They would collapse after they were giving it. They'd have to call 911. They'd have to pick them up, take them to the hospital.
What was happening?
They were low in D, and all the D drove in, I mean the D didn't, but the Forteo drove in all the calcium into the bone immediately.
So when they get hypocalcemia?
Absolutely.
Their calcium levels dropped a lot.
But by the time they got to the emergency room, they were back.
So I missed it.
Nobody really caught it. So this is what they had done all over the period of time they were getting ready to put it on the market. And I began to say to them, you must go back to the FDA and tell them you're going to redo this. And they said, we're not. It's $250 million. Our stuff will be gone. We hope everybody learns your lessons. But sort of to give you a bit of ongoing information about what we're doing, we're going to have the consultant of the Surgeon General of the United States of America come visit you. You're going to have breakfast with him 4 times a year. We'll fly him in, give you bagels, good bagels.
Okay, whole wheat bagels up.
And so we just began to talk, and it was really exciting. The Surgeon General, early in the Bush administration, had given a big speech to the American Medical Association. The speech said, we are losing $85 billion to low vitamin D.
Wow.
Let's get out there and keep up with the rest of the countries. Now we're doing a little bit more, but we're come nowhere near these scientific powers like Canada, who really thinks a lot about D. They're a little further north than we.
They should.
They
Yeah.
should.
Well, that's good. And yet, if you talk to most doctors and you're using those doses of vitamin D, I should say, if they're using those doses of vitamin D, they're probably going to get into trouble because they don't understand the relationship between vitamin D and calcium.
Right, you're exactly right.
So what happens in that setting? What gets you into trouble?
Well, what happens is I give everybody a double-sided sheet of paper that says no calcium, and it gives a long bit of science to explain what it's all about, why I would say that, and why you'd be at increased risk. And most people will sit there and talk with me a little bit about it. And then still, though, when they go to other physicians...
they're up in arms saying, don't listen to that quack.
That's right.
Yeah.
Those are the words.
Yeah, right. Well, it's a compliment because you know your vitamin D. And so when you say no calcium, does that mean that you wouldn't have foods that are rich in calcium?
I don't care about foods. I don't want supplements.
So
foods are... That's foods do, is they come in with vitamin D. That's what they're supposed to do. But supplements are over the top.
Okay, so if you do take supplements with those large doses of vitamin D, what will happen to your calcium?
Well, it steadily goes up, but I think it was the National Institutes of Health about 5 or 6 years ago published a paper. Well, if you take a little bit, and this was 400 units a day, with the calcium that's generally recommended, you're going to get an increase in kidney stones of 13%. That's not health.
And that's not what happens.
And it doesn't, as long as you don't add the extra calcium. That's right.
Right. Well, we know that foods that are, even people who do have kidney stones, if you give them calcium supplements, they get kidney stones that are made out of calcium. But if you give them foods that are high in calcium, they don't. Isn't Mother Nature amazing?
I don't know how we found that out.
Yeah. So the bottom line here is that you have to know the whole story of how to use it. Now, osteoporosis is just one area where you use it.
Right.
Now, there are other places where you're using vitamin D as well. You're preventing people from getting heart attacks and strokes and hypertension. How does that work?
This is something that I am new to this thing, particularly about the heart disease and how you have less hardening of the arteries, you have less heart failure. And there was an article just this last week that talked about peripheral vascular disease, and they had different quintiles, 5 different groups that they put everybody in. The more vitamin D you had in your system, in your blood, the less chance you were going to have artery problems.
Yes, I saw that.
Isn't that really interesting? It's just observation.
Right. So some people who have problems with arteriosclerosis are actually getting arteriosclerosis because you're giving them calcium supplements. in that
That's right.
setting. How does that happen?
Well, the issue is what is doing the work in terms of what's causing atherosclerosis. And we know now basically the underlying thing is some inflammation of some sort. And it just is something that you sort of say, well, okay, what's next? Well, then when you get something inflamed, you get white cells and a variety of other things, including the calcium that comes in there to sort of stop the hemorrhage of whatever's going on. Might be blood, might be inflammation, might be more cholesterol.
Some of the early studies that were done by Kaiser, probably 20 years ago, showed that people who had osteoporosis had a higher incidence of arteriosclerosis, the heart attacks and
That's
strokes
right.
with it.
Yeah.
And maybe this is explaining that mechanism?
I think it certainly is a contribution. There's some more things to figure out, but it is a contribution. And it certainly doesn't say much for the concept of taking a lot of extra calcium.
No, right. So
That's for sure.
we've got that worked out. If you're going to take doses of vitamin D, you better go to somebody who understands vitamin D first. And there aren't a whole lot of people around who do, because I can tell you, I've talked to a number of them, and they're going, who is this guy that's talking about 50 or 100,000 or more units a day for people who have healthcare issues? And you start talking to them a little bit more about the calcium, and they sort of like have this glazed look, like they don't know about it. Who's teaching it?
It's unfortunate that I don't know how the medical schools and all the continuing education courses are doing what they're doing, because they're ignoring it right now. A good friend of mine, Tom Fogarty, who's at Stanford right now and introduced the bypass procedure to the world, he has made a great point of this, that people are not being taught new things. And particularly important when you were taught in grade school about things that are not true anymore. That is really bad, because people tend to figure out what's good for them, but the physician should be able to reinforce that very thing.
Right. You know, we talk about heart disease, and a lot of people talk about chelation therapy. We haven't talked about this before. It'll be
Right.
fun to see what you say. And chelation takes a lot of the calcium out of the plaque, but I'm wondering if just giving big doses of vitamin D would do the same thing.
That's a good point, and I don't know. I do know, though, that when I was sort of interested in chelation, that went all the way back into medical school, I, at that time, said there's something else, not that, that's the inciting feature.
Right.
And I've always tried to go to the source, because then you can take one thing and get rid of it, as opposed to piling them on, just like we do today.
Well, it reminds me of the story of the statin drugs.
Well,
They don't really solve the problem, the primary problem, but they lower the cholesterol, so there's
Yeah.
less of it going in the plaque, but it's not dealing with the inflammation, although to some extent it does. So it's
Yeah.
an interesting story.
Yeah, it really is. And the more interesting thing now is the hint that this may do a lot to prevent Alzheimer's. That's cool.
That could be.
Yeah.
Could be. Now,
Not a big user.
so when we're looking at arteriosclerosis and diabetes, there is a connection with vitamin D in treating diabetes because it has effects on insulin sensitivity and its action.
Yes.
Tell us more about that.
Well, it does just that, and nobody knows the mechanism of that, but the insulin sensitivity gets better in lots of ways. The mechanism may not be known, but the nerves get better as you go up in D. And now we know that the vitamin D does a tremendous amount in the brain, in peripheral nerves, in autonomic nerves. And so as our treatment of any sort of situation for people with diabetes evolves, it always is 50,000 units of vitamin D every day.
And that will do something for the neuropathy as well?
It will. Not alone. It's not that easy, but it does do a lot to help the neuropathy.
Well, there are a lot of people I know we use infrared light treatment just as you do, except I think we're
Yes.
using one that's probably got a lot more power than what you have, so we're having very good results with it.
Great.
But to add things to it, like the vitamin D and the evening primrose, the GLA, and some of the other things that are possible, lipoic acid, makes some sense. So it's nice to have one more tool to add to that in a sensible way.
Yeah, I agree, 100%.
All right, so in diabetes, it's effective. We're talking also about a possibility now of using it in cancer. There are some interesting effects of vitamin D in cancer that have to do with immunity and maybe with vascularization.
Right, it really is interesting, because I cornered a guy from Hamburg, Germany about 10 years ago, and I knew he had given a speech in Chicago, your old birthplace.
Yeah, my hometown.
And he was talking about having to do more and more MRIs because you'd find more and more cancer.
Right.
Then I didn't hear anything of it. And I just really was a little suspicious of why this sort of went away. But here he was in San Francisco. So I had to talk with him. Why do we not do more MRIs? He says, because you find too many cancers too early.
Dear me.
And I said, well,
give me a break.
Go on.
Yeah. What's wrong with finding things early?
And he pointed out that now we understand that breast cancer, for example, is an immune process. And what we saw was something that we thought a cancer was forming, and as it was growing bigger and bigger and having more and more cells form around the whole cancer ball, if you will, and we thought this was going to be a very important thing for metastasis and spreading everywhere. And he said, no, 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 that's where the antibodies come in, and that's when they kill it. The antibodies kill the cancer. And he said, in his work, he thought maybe 3, maybe 10 people a day, 10 cancers a day occurred in most women, but they went away. And literally, if you found them too soon, you'd be biopsying all week.
Wow, that's an interesting concept because it flies in the face of some common sense that would tell you want to screen and find those cancers as early as you can. Because they're the ones that, some of them, are obviously going to grow and create some problems. So I guess it depends on what their size is.
It does, and obviously a lot of other things. But the work that was done 3 or 4 years ago at Harvard, and the unfortunate death of the researcher in an airport not too long ago, cut it all short. But he was doing all this work on how all you could do to attract these cells in your antibodies and other ingredients would change the face of how we treat cancer. It's a brand new concept, and unfortunately, as far as his work is concerned, although he has 70 people left in the lab, he's not going to be working there anymore himself.
Wow.
He's not going to be there.
Well, when you look at cancers, okay, particularly say of the breast, and you see this, what we call increased vascularization, it's called neoangiogenesis, or a lot of tangled blood vessel growth there, that's a sign that a cancer is developing. And then there's something that forms around it, which is what you're talking about.
Correct.
Tell us more specifically what that does.
Well, it brings in the antibodies. There's the big generalization. Since I'm not a cancer researcher, I can't tell you all the special things about it. But I walk all through the physical situations that you would see and how people define whether or not these things are bad or might be bad, or just watch it on the mammogram. And all these things give us a lot of clinical situations that we do. But I am limited to the clinical use.
Okay, now we're talking about the clinical side of it then. Vitamin D could affect that biochemistry and change the actual effect of the tumor. How could it do that?
Well, again, the immune system gets in there and does things, and we move away from, say, one type of cancer to others. And lung cancer has been one that's been sort of interesting for me. I had no interest in it in terms of my profession, but all of a sudden one day someone came to my office and said, I understand you're interested in vitamin D, and I think I'm low from my symptoms. I'd like to be tested, and if I need it, I'd like to get some. He tests low. I gave him
he's average.
Yeah.
Right?
We haven't had a normal person's vitamin D with the new levels ever.
Isn't that something?
Ever.
Wow.
So it is something. But anyways, this gentleman said he was going to Europe and he'd like a year's supply, and we talked about it a little bit, and it seemed reasonable, and he seemed reasonable, and it was just replacement. It wasn't in any danger. Even at that time, I was a little bit worried about the dangers. And off he went. About 6 months later, I got a telephone call from him. He said, I lied to you.
Oh, jeez.
Yeah.
Thank you.
Oh, well, tell me more.
Yeah.
And he said, well, I'd read all about how vitamin D is really strong against cancer. And my brother-in-law had just been told he had 6 weeks to live. And nobody was talking about D.
Wow.
And so he said, I just took it upon myself to go and lie to you. And I knew I'd test low because everybody else
He knew more than the doctors did, didn't he?
True.
As it turned out.
So every year, I get a call about 6 months, about the time that guy called me, and he's calling me to say, how's the weather and everything else? And I say, okay, where's your brother-in-law now?
Right.
And he says, he's still in Acapulco water skiing on the anniversary of his death.
Oh, jeez.
I hope I can tell those stories about lung cancer forever.
So you have had some success. Have you had any other patients who have responded that way?
Prostate cancer. Stanford sent some people over who were, again, 6 weeks to live, and we did a lot of vitamin D, and it worked out basically well.
So you're taking some people who have metastatic, far advanced cancer. Right. They've got months to live, maybe.
Right.
And you're giving them big doses of vitamin D.
Right.
And what's happening to them?
Well, they all are getting better, and it's very important that it isn't just the D alone. This is an augmentation of usual care that everybody would get. This one guy got 13 years of different therapy, and when they sent him over, I said, do not stop anything you would do ordinarily. This is just going to improve our batting average at doing this, but this is not alone. This is not a cure, because some people, like the people who have the lung problems, I tell them you must stay on this for the rest of your life. We don't know anything about this. All we know is you got better. That's nice.
Well, there's something about an outcome study that's positive that's pretty good.
Well, it feels good.
I figure if you got a black box and you put a nickel in and you get a quarter out, you're going to do it again, right? And you don't have to know what's in the box. And that sounds like, in a lot of ways, what you're doing. And I think medicine is moving more towards outcome research because, let's face it, we don't understand the complex biochemistry of a cell. We don't know what goes wrong in cancer or diabetes or heart disease when you get to the level that really is talking about where the action is.
Right.
So that kind of humility maybe will take us to a place where we can start listening to what Mother Nature has to say, and when we try something, see what happens.
I agree 100%.
So you're looking at powerful immune boosting effects.
Correct.
Is it mostly the antibodies that are increased, or is it the cell?
Well, I don't even know the factors that are involved.
I see. It's a big black box.
Yeah, a bigger one.
Okay.
But I got very interested when I heard when bird flu was coming into town that Germany said we aren't going to have a vaccine, and if we did, that would really be tough. It'd be better to boost everybody's immune system. And how is that? Well, what you do is give every pharmacy in the nation 7 tablets of 50,000 units of vitamin D. And anybody, whether you're German or visiting or whatever, gets that little baggie to take in the event that bird flu's in town. And you just need to take it immediately because all you want to boost is your immune system for 3 months.
And that does it for 3 months.
And it does it.
My goodness.
We didn't get bird flu, but I would have loved to have seen how well it worked.
It would have been nice to try it in the 1918 epidemic. They didn't think of it, I guess, at that time.
No. There was one little study that was interesting. It was done in a Atascadero State Hospital, and that's a major psychiatric hospital for California.
Right.
Well, a new guy who just got his shingle and being a doctor became the doctor caring for that unit. And somehow or other he had heard about the thing that they were doing in Germany in terms of treating TB. And he looked at the literature and so forth and said, I bet if I give the second floor 50,000 units of D, and I don't even know if that's the correct dose, it might have been less. If he gave them some during this flu season, none on the first floor and none on the second floor, on the third floor, we would see what happens. And by spring, he had no flu there, and he said, gosh, this is really good. I'll go up and congratulate them all. And so he went up, and there were about 70 patients, 60, something like that, on the floor. And the nurses got all the cards ready to put the charts on, put them on. There were 2.
Wow.
And he said, I want them all. And she said, you got them.
That's amazing.
And the interesting other fallout from this is that seemed to say that they were there for severe depression, and they got better enough so they could all be discharged, but 2.
There's good data to support that now.
Yeah.
The seasonal affective disorder, maybe
There's the other one.
a sunlight problem, okay, but it's vitamin D treats it as well as sunlight.
Yeah.
It may be, and this is just a little anecdotal support for what you said, back when I was in medical school, they had something called a solarium, where they treated people who had TB. And even though UVB light doesn't go through it well, some of it still does.
It does.
And I'll bet that's what was happening in that case, and they didn't know why. Something in sunlight.
Well, you're really right on the button, because all the researchers now refer to the solarium.
Do they?
They all say, and vitamin D research, they all say, see?
Yeah, right. Right.
Remarkable.
So for a lot of infections, what if someone had the new onset of shingles? A very painful condition for some people. Could you use vitamin D in that setting?
I have tried it a lot.
Did it work?
It didn't.
Didn't work.
I was very disappointed, but we're not going to win all these, I know. And the problem is that D seems to have whatever mechanism it does use positively, it takes time. It took months for those people who had prostate cancer to get better. I don't know about the lung cancer, but this is a major thing that we have to recognize. It takes long.
There's one last area where I know you've had some good success with vitamin D that I want to tell our listeners about, and that's in people with neurological problems like MS and ALS and Parkinson's disease. What kind of experience have you had with large doses of vitamin C in those people? Has anybody recovered from it?
Well, I can only speak to the people who have had MS,
Okay.
and I have had remarkable success. One gentleman came in with a similar kind of thing, knowing that I had been interested in D, and he'd been reading about what it would do for other people in other countries. So he said, will you put me on it? I said, I will. And he came in a wheelchair. He said, I don't have to be in this, but I just thought I would be in it for this situation, just because I can move faster. Then in 2 weeks, he walked in to my waiting room, and he was playing with a pencil, flipping it up and down, and flipped it on the floor. And then reached over and picked it up. And to everybody waiting for the afternoon visits, he turned to them and said, I couldn't have picked this up 2 weeks ago.
Wow.
And 2 weeks ago, I did come in a wheelchair. I've given it away. He said, I feel so good, I can't tell you. And
Well,
I'm here to ask Dr. Prendergast if I can run in the beta breakers.
Dr. Joe, it's been so good having you with us. You are definitely the uncommon doctor, a pioneer in healthcare for sure. A lot of the anecdotal stories that you've given us today inspire me, and they should inspire our patients and the doctors as a community to begin thinking in a more open-minded way of how we're going to be looking at treating some of these challenging diseases. And it's not like this is a panacea and a cure-all for any of these problems.
Correct.
But it's a way to get started, and it's one more tool in the basket, okay, that we can use in our armamentarium that might make the difference of saving somebody a lot of grief, whether it be diabetes or an infection like tuberculosis or an autoimmune disorder, multiple sclerosis, heart disease, diabetes, cancer. I mean, the list is remarkable. We talk about this wonderful, powerful hormone, vitamin D, and all its and all the things that it does. Just wonderful that you've studied it all this time and given us some food for thought. I can't wait to see what's going to happen in the next couple of years. Thanks so much for joining us, Dr. Joe.
Thank you very much for having me.